A community is only as strong as the care it shows to its most vulnerable members. At Alliance Community Hospital, we recognize the special care that is required for many seniors and others facing unique health challenges. That's why we offer a full complement of senior-related transitional, skilled, and intermediate healthcare services through our Community Care Center and Senior Care Unit programs. Not only do we offer all the clinical specialties of an extended care facility, we are also the only center in this area to offer specialized geriatric psychiatry services for our population of elderly residents facing age-related mental and/or emotional challenges. We're the only Planetree affiliated site in the region. All of our colleagues undergo Planetree orientation in addition to their job-specific certifications and qualifications. But at Alliance Community Hospital Community Care Center, what matters to us are our residents. The people who come to us in need of care are the reason we do what we do with such passion and commitment. We simply love our residents.
Well, the staff is the first thing that sets us apart. We have a very skilled and caring and compassionate staff, and that just love what they do. They're very passionate about it, so it's not a job, it's their passion. If you go into another facility, I always recommend that families take use their senses when they walk into another facility to see what's happening, and not just with their eyes, but also with their senses. Does the staff interact with the patients and the residents? Do they, maybe touch them as they walk by, or is there anything you need? Do they smile? And does it smell and look clean? And what is the environment like? But also the interaction with the staff is an important thing.
What sets our programs apart from other facilities? We offer extensive programs to diagnose and treat various neurological, musculoskeletal, and post-surgical cases, and create individualized care plans that are supported by the only inpatient rehabilitation unit in the region.
Well, the therapy that we do here is very much an important part of the overall experience at the skilled nursing facility. We're very geared towards the therapeutic services that we offer so that we can get people to a homegoing setting. We have a very large state-of-the-art therapy gym. Some of the amenities include an activity of daily living suite. We have a car so that people can practice car transfers, and the room itself is large enough where we can accommodate a whole host of functional activities so that we can best replicate those activities that those patients would need to perform in going home. We have a very large, very experienced team, occupational therapists, speech therapists, physical therapists, that have about 120 years of collective experience. They all work together on focusing on different aspects of their discipline so that they can come up with one care plan for that patient that's truly individualized, and that they're all working in sync, going to the same goal.
Our facilities are supported by a fully integrated and multidisciplinary acute care hospital. Lab, imaging, and other tests and scans are all available on site.
Well, we offer everything that every other skilled nursing home or skilled unit would provide, a nursing home would provide, but there's a lot of advantages to our facility versus other facilities. On campus, we have 24/7 physician that is accessible if needed. We have an emergency department on campus. We have the x-ray, the lab work for the blood draws. We have a pain clinic on campus. We have a wound center on campus. So we can provide all of those things that if someone went to another skilled facility, that they would have to be transported to the hospital or to another campus to be provided those things.
At Alliance Community Hospital's Community Care Center and Senior Care Unit, our patients, residents, and their family members are our highest priority.
Most of the patients that we take care of, their skilled stay, so they're in for a short period of time and they're just rehabilitating to get stronger to go home. But we also, when nursing identifies a need or if therapy identifies a need, our long-term residents also participate in the therapy program. Well, the fact that we're Planetree certainly is integrated into all that we do here at Community Care, whether it's nursing or whether it's therapy. And certainly we recognize that when we're working with individuals, it's not just a physical rehabilitation, that there are many other components and layers to the rehabilitation. Sometimes it's emotional, sometimes it's confidence, overcoming fears, challenges that they're going to face in their home environment. So the aspect of Planetree really allows us to look at the whole person. It feeds into how we view that patient in terms of involving their family members when we're working with them to educate them to be care partners or working on family instruction so that when they return home that family and that spouse or that care partner is confident in regards to taking care of that individual patient.
We recognize that at this stage of life, specialty care isn't just necessary, it's essential. Our mission is to provide clinical excellence in the most soothing, healing environment. We are proud to provide our patients and their family members all the comforts of home.
I mean, these are the therapy staff that I would want taking care of my family. And I say that all the time, but those are not just words. Honestly, this is the place that I would want my family to be taken care of because I know the staff and I know their passion. And I feel like I serve that daughter role for many of them because just as with my parents, I would do anything for them. I would, jump at the drop of a hat for them. And I want to make them laugh and make them smile. It's, not unusual to see me go out first thing in the morning while they're having breakfast and play a song or kind of sing and get them all involved. Sometimes I have the staff come in and we kind of dance a little bit for them, whatever to make them smile. And I know our residents and our patients always tell me that it gets their day going, that they like to see that and hear that, and they like to see that the staff are involved in, trying to make them happy and try to get their morning going.
We have quarterly surveys where we ask patients for their responses, and I monitor those so that I can see or identify areas that we need to, really look at our services or identify an area before it becomes too large of a concern. We consistently score very well, which is good. But the thing that I probably look forward to the most are the patient comments, because that allows the patient to really, in their own words, tell us about their experience. When I look at those, it really captures that patient's voice in terms of the impact that we've been able to have on them or in their lives. It lets me know that the team is doing the job that they need to be doing, but it also, I think, conveys the strong relationship that's formed between the therapist and the patient and their thankfulness and their appreciation.
We have residents that live here that we can connect with them. I love the patients that we get to see go home, that we work with them and then they get to go home. That is so exciting that we have given them more time at home. But I also love that we have residents, that it is more of a family atmosphere, that we can nurture them. Not many hospitals, actually I don't know of any other hospital that actually has a nursing home skilled unit that has residents that live there. And so these residents become so much a part of our family, and I love to nurture that and be part of a family environment.
The senior care services of our facility are rooted in compassion and committed to quality. Come to Alliance Community Hospital and truly experience health caring.